So hello friends, welcome to my new video. So today in this video I'm going to discuss with you all about a very important topic that we all should know, that is the basic terminologies which is used in pharmacology. So as we all are in optometry field, so we also need to know about those pharmacological terms. Suppose you are in a hospital and working with a consultant, and at that hospital the consultant is prescribing different medications, antibiotic, antiviral, antifungal, depending on what type of infection is going on. And as you are also working there, so you should know those basic terminologies which is used by those consultants to cope up or to cooperate more nicely. Okay, so let's start this discussion now. So first of all, we will start with pharmacodynamics. So actually pharmacodynamics means, here I wrote that pharmacodynamics or pharmacological effect. So pharmacodynamics means that what the drug does to the body. That means the action of the drug that is produced in the body is called as pharmacodynamics. Okay, so there is a basic purpose to take drug. Okay, so suppose you are infected by bacteria. Okay, there is bacterial infection, so to treat that bacterial infection you are taking some drugs. So the purpose of taking drug is to treat that bacterial infection. Okay, so after taking the drug, suppose you would have taken the drug orally, a tablet. Okay, so the action that is produced by that tablet in your body after certain period, that will be called as it's pharmacodynamics. Okay, so the action can be a good action or it can be a bad action. Good action means the drug is able to treat that abnormality nicely, and bad action means there is some side effect is there, but there is certain action is going on now, and that action is called as pharmacodynamics. Okay, now let's move to pharmacokinetics. So pharmacokinetics, from this word kinetics, it's a physics term, that is kinetics. So kinetic actually means the movement. So the movement of the drug in the body, that is known as pharmacokinetics. Okay, so so pharmacokinetics actually tells that what the body does to the drug. Okay, so suppose you have taken a medicine. Okay, and the medicine have certain amount of effect or pharmacological effect. Okay, so after that effect, suppose you have taken antibiotic drug for a bacterial infection, so the drug is produces effect at certain amount of time. Okay, and just think about the situation that what if the drug is do not eliminate from the body and it remain in the body. So obviously it will produce some amount of side effect. Okay, so to reduce the drug amount, or to eliminate the drug fully or completely from the body, a proper step by step movement is there. Okay, and that movement, that here I have chosen this picture. Here you can see that liberation, absorption, metabolism and excretion. So we will see these steps in a flowchart also. So here, what does the body to the drug? First of all, you have taken the drug. Okay, like you have taken oral tablet. Okay, so that tablet will go to the gastrointestinal tract, and after that it will go to intestine, and then absorption will be there, and after that absorption, drug will get reach to the blood flow, and it will get distributed to the organ. Okay, and after that metabolism and excretion. So the most important is elimination here. Okay, so because we need to remove or eliminate the drug from the body to avoid any type of side effect. Okay, so suppose the drug is water soluble, then it will get excreted through urine, and lipid soluble drug will get excreted via the stool. Okay, so this is the flowchart here. Drug taken in any route, suppose oral route tablet, reach to GIT, and then disintegration and dissociation. Disintegration means breakdown of that tablet into smaller particles. Okay, and dissociation means the mixing of that smaller particles of the tablet to fluid, and then that fluid will absorb by the villi present, and then it will reach to blood flow, and that blood flow will distribute the drug all over the body. Okay, and then metabolism by liver will be there, and after that excretion, depending on what type of drug you have taken, the excretion is there. Okay, so this is how the pharmacokinetic process is going on. Okay, now let's move to chemotherapy. So actually chemotherapy is a treatment of a systemic infection or malignancy, if there is a malignancy present in the body like tumor, cancer cells. So with specific to treat that malignancy or cancer cell with specific drug that have a selective toxicity for that malignant cells, where there is no or minimal effect on the host cell. that is chemotherapy. Okay, so suppose you are having some malignant cells in your body, so the chemotherapy drug will target those malignant cells only, where there is no effect or a very minimal effect on the host cell or the host body. Okay, so that is chemotherapy. Now let's move to bioavailability. So what is bioavailability? So actually bioavailability tells us that how much amount of drug is reaching to the systemic circulation. Okay, so suppose you have taken 100 amount of drug. Okay, it can be tablet or it can be sublingual or from any route you have taken 100 amount or 100 unit of drug. So from that 100 unit of drug, how much amount of drug is reaching to the systemic circulation at how much time? That is known as bioavailability. Okay, so here you can see this is the GIT and this is the metabolism and this is bioavailability. Why metabolism by liver? So suppose you have taken a tablet form orally, now that tablet will go through the GIT, and in that GIT some drug have a tendency to get metabolized by liver. Okay, so that is known as first pass effect that I will discuss in the next slides. Okay, so how much amount is actually reaching to the systemic circulation? So ultimately the aim is to produce the proper pharmacodynamic effect in the body to treat that abnormality now. So that is the main aim. So for main aim, drug should produce its proper or proper action. It should not be less. Okay, so this is why bioavailability is very important. It tells us that how the amount. Okay, so from this graph we can easily understand. So in the y-axis this is the plasma concentration and this is in the x-axis there is time. Okay, so here you can see that there is 3 drugs are there in the A, B and C, and this is the therapeutic concentration. So suppose you have taken a drug and it will reach to it is going to the different parts of the body like a GIT tract. Okay, so the drug will produce its effect when the drug action will cross this therapeutic concentration. Okay, but you can see that A is crossing this therapeutic concentration, but C and B are not at all crossing this therapeutic concentration. So from this you can easily understand that A is an ideal drug where B and C are not producing the amount that is needed. Okay, so even after taking this B or C drug, the expected effect or pharmacological effect that should be required to treat that abnormality or disease will not produce, and it will worth it. So this is why A drug should be taken instead of B and C. So this is from this graph it is easily can be seen. So the rate of amount of drug that reach to the systemic circulation of the body after absorption. Okay, so after absorption is the absorption by the blood stream and distribution to different organ. Okay, so the state of the drug administration also matter. So another thing in bioavailability I want to add is that there is no such drug is having 100% amount of bioavailability except intravenous route. Okay, so if the drug is administered intravenously, it will directly reach to the systemic circulation, but except that intravenous route, that is telling I am about the paracentral route, if the drug is administered through other route, it will not produce 100% bioavailability. That means there will be lesser amount will be reached. Okay, now to calculate this bioavailability, there is a formula. Like here, the bioavailability is expressed as area under curve by oral route. Okay, area under curve. Suppose this is the area under curve by oral route divided by area under curve by intravenous route. Intravenous route is having 100%. Okay, so suppose this is the oral route tablet and this is the intravenous. Okay, so area under curve by this oral route divided by area under curve by intravenous route into 100, and the result you will get, that will be the bioavailability of that drug. Okay, now let's move to bioequivalence. Okay, so what is bioequivalence? So suppose you have a medicine or a tablet, okay, of X medicine. Okay, so this medicine having the different branding or different company, that means the same medicine is manufactured by different company. Like paracetamol, you have suppose as an example. So paracetamol is manufactured by different company. So bioequivalence actually tells that is there the action produced by that paracetamol, that is a painkiller, the action, the pharmacological action produced by that tablet or medicine is equal in that two drug. Those drugs are similar or same, but the manufacturer is different. So these two drugs effect is same or there is different action is there. So suppose here first drug is in this graph, you can see this is the first drug and this is the second drug, and their efficacy is not equal. Okay, so here the question, again I repeat that the here the question is whether this same drug of different company have same effect or not. That is the bioequivalence. Okay, so bioequivalence, actually there is several types of bioequivalence are there. So why bioequivalence? So bioequivalence is to see whether the same drug of different brand have same effect or there is different in their efficacy. Okay, so first of all, let's start with the discussion on those types of bioequivalence. Let's start with the chemical equivalence. So in chemical equivalence tells us that is the chemical composition of these two same drugs produced by different manufacturer are equal or different. There should be equal chemical composition in these two drug. Okay, then it will be called as chemical equivalence. Okay, so even after having the same chemical composition, it does not mean that there is same amount of therapeutic equivalence is also there. Okay, it can be different. So therapeutic equivalence actually tells that same drug of two different companies produce the same therapeutic effect or there is different therapeutic effects are there. Okay, that is therapeutic equivalence. If these two drugs produced by different company, the same drug, is it producing the same therapeutic effect in the body or the effect is different? Some drug is producing good effect than the other, like this. So if these two medicines are producing the same therapeutic effect, it will be called as therapeutic equivalence. Then pharmaceutical equivalence. So pharmaceutical equivalence means suppose you are having 100 unit of a tablet formation of a drug and another 100 unit of same composition, same chemical composition of other drug, but it is in solution. So even after having the same composition and everything is same, manufacturer is same, it does not mean that their therapeutic equivalence will be same. Okay, so the pharmaceutical equivalence will be established at that time when the chemical composition, and therapeutic equivalence and the route of drug administration is also same, then only it is called as pharmaceutical equivalence. Okay, and after that biological equivalence or bioequivalence. So bioequivalence tells that when drug administered in the body, it should give same plasma concentration profile. Okay, in the body, if there is a different amount of plasma concentration profile in the body by applying those two same medicine which is manufactured by different company, then it will not called as biological equivalence. Okay, so this is bioequivalence. I hope you understand. Now let's move to the second next slide here, distribution and redistribution. So what distribution actually mean? So distribution means to distribute something. Now here the distribution of that drug in the body. Okay, so that is called as distribution. So distribution means how the drug is distributed in the body with the help of blood flow, but it doesn't mean that the distribution of the drug throughout the body is equal, because the organ in our body, not every organ is having the same amount of blood flow is there. Like there is some organ which are having more blood flow than some other organ, like brain, liver. Those organs are having more blood supply than other organ. Okay, and adipose tissues like this type of parts are having lesser blood supply than if we compare it with brain. Okay, so if there is any higher blood flow, it means that there is more amount of drug distribution will be there, and if there is any low blood flow is there, then there will be low distribution will be there. Okay, so the organ with higher blood flow having more drug distribution than less blood flow organ, that I already said. And the another thing is that capillary permeability, that how much permeable the capillaries are. So the more the capillary permeability, it means that there is more drug distribution is there. Okay, and another is that highly lipid soluble drugs are having more distribution as they can easily pass through the blood-brain barrier. Another important thing that I need to add is that if the drug is having lesser time taken in disintegration and dissociation, then it will have more time for absorption and distribution. Okay. Now let's move to redistribution. So what is redistribution? So actually redistribution means like highly lipid soluble drugs uh, get initially distributed to organ with high blood flow. That means I already mentioned the organ which are having high blood flow like brain, heart, kidney, liver, etc. So from that organs, those drug will get slowly distributed to the lesser blood flow organ. Okay, so this is called as redistribution. So redistribution actually very important in case of anesthetic. Anesthetic agent like thiopental sodium is having the redistribution. Okay, so because in anesthesia or if there is any urgent need or to produce the drug action in the body, then the redistribution should work. Okay, that means there should be a higher highly lipid soluble drug should be administered to produce first effect of that drug in the body. Okay, then it is called as redistribution. Okay, now another thing is that first pass metabolism. Okay, so what is first pass metabolism? So here suppose you have taken a medicine like in uh, what to say, orally tablet. Okay, so that medicine will go through the gastrointestinal tract and then intestine, and then it will reach to blood flow and then distribution. Okay, so in the pathway, um, biotransformation or metabolism of the drug by the liver is there in some drugs. Okay, so first pass metabolism is called when there is biotransformation of the drug by liver or gut enzyme before the drug reach to the systemic circulation. Okay, so it leads to lower bioavailability, as I already told, and so the manufacturer always want to avoid this first pass effect. Okay, so if one drug, suppose you are putting that drug or administering that drug orally and it is showing first pass effect, then you will change the route of drug administration and you will try to administer that drug in other route, so to avoid this first pass effect. Okay, so there is some examples of first pass metabolism that or first pass effect, those drugs showing like isosorbide dinitrate or glyceryl trinitrate, levodopa, alpha methyl dopa, etc. So these drugs are showing first pass effect. Okay, or here nitrates are also used. Now another thing is that plasma half-life. So what is plasma half-life? So plasma half-life of a drug is the time taken for its plasma concentration to be half of its original value. That means suppose you have taken 100 milligram dose of a drug. Okay, then at how much time this 100 milligram dose of a drug become 50 mg, then 25, then 6.25. Okay, like this. So suppose as an example, you have taken a drug which is having you have taken a drug of 100 milligram dose, okay, intravenously, which is having 15 minute of plasma half life. So it means that 15 minute after the 15 minute the drug administration, 50 milligram of the drug will remain from that 100 mg, and after 30 minute there is 25 milligram drug will remain, and after 45 minutes there is 12.5 milligram drug will remain, and after 45 to 1 hour there is 6.25 milligram. Okay, and after 2 hour there is 0.39 milligram drug is remain in the body. So this is plasma half life, and actually plasma half life tells us that when to administer the second dose of that the same drug to maintain the consistency or consistent level of the drug in the body. Okay, so if suppose you have instructed to take a drug 3 times in a day in 4 hours gap, okay, or 2 hours gap, and you are not following that instruction and you have taken one tablet in the morning, and after 6 hours you have taken another tablet. So in between that period, so there is a plasma half life is working, so the amount or concentration of the drug in the body is reduced, so that As the reduction of the amount or concentration of the drug is there, then there will be lesser action of the drug will be there. Okay, for that lesser action of drug, there will be lesser pharmacological effect, so that your disease or disorder or abnormality, for that purpose you are taking the drug, will take more time to be treated. Okay, so for that purpose you need to follow those instruction very rightly to so that you can easily treat the abnormality. Okay, so that is the importance of plasma half-life. Now this is the graph here. This is the dose, double dose, and this is the single dose. Okay, this is double dose 100%, single dose 15, then 25, then 12.5, and so on. Okay, then after that, clearance. So what is clearance? So clearance, it tells the rate of elimination of the drug from the body. So you are taking drug for any some many purpose. Okay, some people take drug for prevention, some people take drug for treatment, and some people take drugs for nutrition. Like prevention here, coronavirus is growing very rapidly in our country. Okay, so there is very many people are having very furious to take the coronavirus or co-vaccine. Okay, so what is this vaccine? That is a prevention step. So after you take the vaccine, like first dose, and after 28 second dose, and after 2 weeks after the second dose, you will develop inbuilt immunization in your body to prevent the coronavirus, so that even after you get affected by coronavirus, you will not die, or the condition will not get serious than the person who not taken that vaccine. So this is the purpose of taking the vaccine, to have a immunization power or resistant power against that pathogen. Okay, and some people take drugs like supplement, like vitamin A or omega-3 fatty acid. Why they are taking it? For to produce some pharmacological effect, no? Because that omega-3 fatty acid having several benefits in the body, like it is very benefit to avoid the ARMD, or it is very benefit in dry eye, or it is very beneficial to eyesight as well as liver, heart, etc. So and total body metabolism. So the action that is produced by that omega-3 capsules, that is the dynamic effect. Okay, and the and that omega-3 fatty acid also have a proper way to elimination. Okay, and it will get eliminated via stool. So this is how it is working. Okay, so this is the clearance. Clearance is the